Hi, and welcome back to Allscripts TV. My name is Kim Lockard. I'm with the Allscripts Innovation Team, and today I have Terri Townley, Office Manager of SAMA HealthCare, and Dr. Gary Bevill, Lead Physician out of El Dorado, Arkansas. Thank you for being here with us today.
Thank you.
Today we're talking about the eDoc4U solution. eDoc4U offers a Medicare Annual Wellness Visit check. eDoc4U is an Allscripts developer program partner, and we're very excited to talk about some of the solutions and results that you've experienced at SAMA HealthCare. So what we're going to talk about today is just a little bit about your practice. Tell us your number of physicians, solutions that you use today, and the patient population that you serve.
Okay. We have 5 doctors now, 7 APN or nurse practitioners or extenders. We have everything on site, x-ray lab, and other ancillaries in our clinic.
And Terri, I know as the office manager, you're really in charge of the business solution. So tell us a little bit about the 2 Allscripts solutions used today to manage the health of your business.
Well, we have the PM and then Follow My Health and eDocs4U.
And eDoc4U, the developer application that we have. And from a clinical standpoint, Dr. Bevill, tell us about the clinical software that you use to manage your patient note and the overall health of your patients.
Okay. We're using Allscripts Pro or Allscripts Professional. We have been using it for 12 years, and we have, in the process of, we're one of the CPCI clinics, and I have been a beta partner with Allscripts, so we have kind of pushed the envelope, and we've always been looking for a way to keep the patient center, to keep the patient health, or keeping the patient foremost in the encounter. And with Allscripts Pro, and then having seen and now worked with eDoc4U, it was a way to further extend and offer a much greater value to our patients.
And so eDoc4U offering the Medicare Annual Wellness Visit solution. Tell us about that. What is that? Why is that required? And how has that solution helped streamline that process for you?
Okay. Well, the Medicare Wellness Visit it's stressed in Medicare that it's not an exam, that it's an actual visit, it's a risk assessment, it's also a safety and depression assessment. So it's a very lengthy, especially if you do it on paper, a lengthy process to complete and go through. But it identifies a lot of areas that, as physicians, we need to know about. What eDoc has done, which has been great, is they can complete it online, they can take their time, they can come back to it if they don't want to finish it all at once, and it asks every one of the questions that are required for you to build the Medicare Wellness Visit code.
That's fantastic. And from a patient's perspective, how have the patients appreciated that interactive technology as opposed to having to fill out forms, or maybe, I know from a Medicare standpoint, the patients are typically older, right? So,
right.
Has that really helped? I mean, the comprehension of it, is it essentially the same sort of experience that they would have, the same types of questions, just in electronic format?
Basically, that's the case. A lot of the scales and screening tools that you're supposed to use, eDoc4U built that in, and the product is very intuitive. It's written on a level that you don't have to be a college graduate, and even for seniors, if they can figure out how to get online and use a computer, completing it has not been a problem. We're in a rural part of the state, and some of our seniors do not use computers, so it's still a bit of a challenge, but we think going forward, obviously, that it will get easier, because as the population ages, people will know how to use their smartphone.
People are adopting that technology faster anyway. So from a clinician's point of view, how does that empower you to do your job better?
Well, when they complete the eDoc4U Health Risk Assessment, or HRA, it is color-coded into high risk, medium, and low risk. It tells me exactly what they are due, immunizations, tests like colonoscopy, and everything. So it gives me a concise tool or a concise report to see what the patient needs. It also, again, documents the Medicare wellness screening, which one of those is depression, and the idea is that I may not have picked up on the fact they're depressed, but that screening tool a lot of times will pick it up.
And then Terri, from a business operations perspective, having the integration, talking to Follow My Health and having all of this information tied in together right at your fingertips, how has the business operations staff, how have they noticed, higher efficiency? Is it taking longer, or is it speeding things up for them?
Well, it really has nothing to do with that piece of it. They have had to kind of teach the patients how to use it. And then when the patient finishes that, it tells the patient how they're doing. They get to see that too, not just the doctor. They get to see how they did on it. Right. And we use Follow My Health, and through that, we can invite them to use this product. So it makes it easier for the patient to get to this, to use it.
And it makes it a very seamless experience for all involved. Okay, great. Well, you heard it directly from our clients, and you can talk to the eDoc4U staff today in the Allscripts Developer Program Partner Pavilion or at store.allscripts.com. Thank you so much for being here.
Thank you.
Appreciate it.